Hey, welcome back to another episode of The Art of Giving a Damn. And today we have Aleksandra with us, who is a registered physiotherapist and treats patients with musculoskeletal conditions. She graduated with a master's in physiotherapy from the University of Ottawa and in 2017 opened her own clinic with a vision to provide tailored hands-on treatment to her patients. She's an advocate of regular physical activity to improve your strength, your flexibility, cardiovascular activity, and you've got a little bit different of a take on how people should approach their own wellness and taking an active role in that. So thank you for coming on the podcast today. I'm excited to have a conversation with you.
Thank you so much for having me. It's an absolute honor to be here, and I'm excited to share my story with your audience. So I'm looking forward to this.
Okay, so let's start there. How did you end up going this direction with education and then opening your own clinic?
You know what? I always knew I was going to be a therapist. I wasn't
Mhm.
exactly sure what kind of a therapist. I knew I was going to be working in the medical field. But the way things worked out for me, I got into the physiotherapy program at the
Mm.
University of Ottawa a few years ago. And I struggled there a little bit. I wasn't sure if it was the right thing for me or not, but I
Mm.
pushed through. And then when I graduated and started working, I fell in love with it. And
Okay.
I was just so grateful to have come across, the profession, and haven't really looked back since. So I guess I knew what I was gonna do always,
Uh-huh.
and it worked out. You know.
That's that's very cool. I think we all have those moments where we feel like we're started in the right direction and then we stop, like you said, and you kind of have to push through sometimes. So what inspired you to keep going when it got a little bit tough in college?
You know what? I don't. I'm a person that doesn't like to give up and or to leave things unfinished. So
Mhm.
if I start something, I like to finish it, and to see how it's gonna pan out in the end. And then if I don't like it, at that point I can decide to keep going with it or to
Mhm.
change it.
Gotcha.
And like I said, when I started working, everything really changed 360 degrees around for me. And
Mhm.
despite the fact that I had so much trouble in school, I fell in love with the job. So I was just so happy
Awesome.
to have pushed through. And no, I'm happy where I'm at. Really, it's been a awesome journey.
That
Uh,
is really great to hear
yeah,
because I think we do sometimes give up too soon on the things that if we just push a little further and just get to that point where we're working with clients or working with patients, then we remember why we fell in love with what we
exactly,
wanted to do. Okay, so
exactly.
for anybody listening who has no idea what a physiotherapist is, what exactly do you do?
So, physiotherapy is a discipline where we look at a person's body and limitations of the body
Mm.
and limitations in function, limitations in movement. We'll do specific tests and we'll do some observation in order to determine what the cause of the problem is, or the pain or the injury that they've encountered. And based on those, the test and the observation, will design a treatment, right? And so we'll provide treatment specific to each condition, and after that we'll give exercises and stretches in order for everybody to rehabilitate and recover better from their and faster from their injuries.
And your approach to it focuses more on active treatment that doesn't involve medications.
No, the treatment that I provide involves no medication at all. It's all hands-on, so it's all human touch. It's all human interaction, which, in my opinion,
Mm.
helps a little bit more, with the healing process and the speed of the healing process. So that's what I focus on is really just providing that hands-on touch, at least while they're with me, in
Mhm.
therapy sessions. And then, like I said, I always give them homework for to work
Yeah.
on their own afterwards, because it's important. You spend so little time with me and so much more time at home and at work, so what you do outside of the therapy session is really what's gonna is what helps most, if you
Mhm.
ask me.
So what are the conversations that you have with people around this? Because many of us have grown up and we're more conditioned to the Western medicine approach of you go in, you tell the doctor your symptoms, and they prescribe this, whole list of pills to mask whatever's going on. Do you find that most people who come to you are pretty open to a different approach, or is it something you have to kind of help them open their minds to?
You know what? It's been 50-50, I would say. Some people are really open. They've heard of physiotherapy and massage therapy and acupuncture and other therapies like that.
Mhm.
And a lot of them have already tried a bunch of those. And then some have not. Honestly, some have just been taking medication. And every time somebody tells me, oh, my doctor never prescribed physio until now, I almost want to pull my hair out. I'm like, that's so not fair because there's just
Mm.
so much more you can do before you even go down the drug and the medication route. So I just try to educate my clients by telling them, they have all these options and it's up to them
Right.
to choose which one is the best for them. But I think ultimately they have to, try everything out
Yeah.
before they can say, if it's working or not, right? Um, so it's a lot of educate. There's a lot of education that goes on behind what I
Mhm.
do.
Yeah, I can imagine. I think a lot of times we don't realize the options that we have, and it's something where you've got to become your own advocate and start researching what else can I do to fix this or change this. And that's where we tend to come across, oh, there's this whole other modality over here that I'd never even heard of. So, what for those who are listening who have maybe similar businesses to yours that are a little bit maybe outside of mainstream, what's worked for you as far as getting the word out more about what you do and being able to get in front of more people so they know they have this other option to be able to help their body heal?
What's worked in terms of business,
Mhm.
or
Mhm.
a lot of business for me has been word of mouth
Yeah.
and referral from the doctors that I'm working relatively closely with.
Mhm.
So I'm happy about that. Actually, I'm happy that this one doctor in particular is very open to referring his clients to me.
Mhm.
When he deems that to be the most appropriate way. So that's those are maybe the two ways that have worked best for me.
Yeah.
And so I try to focus on that. I try to provide the best kind of work that I can, in the hopes that my clients will also refer more people afterwards.
I think that's always a great testament to the work that you do when you have other professionals who are willing to refer people to you and intentionally looking for those people to be in partnership with is such a great way to grow what we do. Find the people who are complementary and figure out how to work with them.
I agree. I think
Yeah.
it's ultimately the best way because when I'm looking for someone, I always ask
Yeah.
for referrals or for suggestions or for recommendations. I mean,
Hmm.
sometimes I'll also look it up online, but there's just that extra little aspect of it when you're referred by someone who's had a good experience with someone else.
Right. It makes such a difference. And it's easier, especially for something that is a little bit more of an alternative approach. If somebody else recommends you and says, hey,
Exactly.
this worked for me, or I've seen this work for patients.
Exactly.
Yeah. So what's your absolute favorite part of what you do?
My absolute favorite part is really seeing the before and the after. So, really, when they first come in and they have all this
Mhm.
pain, or, they're suffering, you can just see that they're not feeling happy, that,
Mhm.
the pain and these injuries are limiting them in their daily lives. And then working through it all to at the end, see them much happier with a lot less pain, and then being back
Mhm.
at the sports activities or leisure activities, whatever it is that they wanted to get back to. So it's amazing to see that difference, the before and the after. It's a pleasure. It's an awesome feeling.
I can imagine, sometimes it's easy to focus on this is the specific thing that we do instead of remembering the amazing difference that it makes. And that's something so visible where you can see somebody come into your office just not feeling well, down and frustrated, and be able to show them just a few things and work on them in a way that they literally leave different.
Exactly. That's exactly what it is.
That's amazing. So what have been your favorite clients that you've worked with so far in your practice?
I had one client who had a lot of neck pain that was going
Mhm.
down to the right shoulder and upper back, and um, very severe, very
Mhm.
very bothersome. But we were able to work through it. It took us a little while. It took us about 3 months, but he's
Mhm.
much better now. He's only coming in now for maintenance purposes, which is awesome. And so just to be able to see that he's incorporated all these little things in his life,
Mhm.
in his daily routine, that have made such a difference in the way he feels and the way he walks and does things. um,
Mhm.
is been rewarding. It's really been amazing.
Okay, so that's actually a great example. I know a lot of my listeners and a lot of the people that this will be in front of, they are online entrepreneurs or they're in business for themselves. They're sitting at a desk at a computer a large percentage of their time, and I think they probably, when you said neck pain, they're probably thinking, "Oh yeah, I understand that feeling." What are two or three things that we should be watching for to help reduce that type of problem and maybe be able to better care for ourselves in that way? I know everybody always says sit up straight. Other than that,
Yeah, no, I would say just try to avoid prolonged positions, whatever they
okay.
are. So even if it's sitting, it's sitting. If it's
Mhm.
standing, it can be that as well. So try to move or try to change positions as often as you can.
Mhm.
So that's one thing. And then I would say just to try to incorporate little things, like if you can park your car a block or two
Huh.
further, and walk that distance instead of parking, in the underground garage, is one little tip. Or just, if you have if you can come up with a exercise routine after or before
Mhm.
work, is something that I always highly recommend, is having, that set in your schedule. I know it helps me a lot,
Yeah.
not just physically, but also mentally.
Mm.
So for all of those people who don't have the time, or make the excuse of not having enough time to exercise or to work out,
Mhm.
um, I think has to stop, because you're just doing yourself a disfavor by not doing it, right? So
Yeah, I can imagine there's a lot of people who come to you who they probably knew better than the lifestyle choices they were making, and they've hit a point where, okay, now it's time to actually do something different.
exactly, exactly, yeah.
So, what are the situations where somebody would give you a call? Like, what are some of the problems that you treat, or the symptoms that somebody should be thinking, maybe this is something I should look into?
There's a lot of, for example, headaches that
Mhm.
we can treat, which can come from stiff neck, the joints in the neck, tight muscles around the neck. There's a lot of numbness and tingling in the hands or the feet. That
Okay.
can also be treated by physiotherapists. And then,
Hmm.
you have your typical, like, neck pain, shoulder pain, low back pain, low back strains, herniated discs, sciatic issues where the sciatic nerve going down from your low back to the legs is inflamed. That's a huge one. It's very painful. That's another big thing that we can treat.
Mm.
Things like that, inflamed tendons like tendonitis or bursitis, all these chronic conditions that may seem, like nothing, but
Mm.
if left untreated, can cause damage. So just something to keep in mind is that even if you can live with the pain, and sometimes you can, it's not always a good idea.
Mm.
Because of all the things that it can cause afterwards. So scar tissue, compensation's huge. If you can't walk properly, then you're going to develop problems elsewhere, which can, cause more pain.
Yeah.
So just something to keep in mind.
That is really important because I think sometimes we're conditioned both to just want a pill to make the pain go away and to think, you got to be tough, suffer through it. And
Yeah,
instead, you need to really be listening to your body and think, okay, if I'm feeling pain, there's something else going on. I need to get to the root of it and actually solve it. Because most of the time we don't have to live with that if we're willing to look for options.
Absolutely not. And the pain is, to me, is sometimes a really good thing. It's not a bad thing. It's your body telling
Mm.
you that there's something going on, that you should seek help, for it. And so when you do encounter pain or discomfort or unease, then by all means seek, help, seek guidance, consult with someone.
Yeah. So speaking of consulting with someone, are most of your clients, they're physically there with you in person? Do you do any virtual work, or how does somebody find someone who does what you do wherever they're at?
So I haven't done any virtual
Okay.
work. So far, it's been only physically,
Mhm.
manually treating someone.
Yeah.
It's something I would actually like to get into, is
Okay.
virtual, because
Yeah.
the number of people I can reach is so small compared to the number of people that I want to reach ultimately, right? But I mean, no, people can look up, physiotherapy in, their specific area or their specific town
Mhm.
or city, and there should be lots of option. So we're all over the place.
That's awesome. So, for those who are listening, if you want to get in touch, Aleksandra's website is anphysio.ca. You can find her there. If you are in Toronto, right?
That's it.
Toronto, okay. And yeah, I think what you do, there's so many cool ways you could bring that online and virtually help a lot of people, because so many of us have no idea. We are aware, the government tells us you need to get 20 minutes of exercise 3 times a week, and we're supposed to eat like a pyramid, which that's a whole different topic. But there's a lot more to it, I think, of little changes we can make, like you shared, of park your car a little further away, get the time in your schedule to exercise, to take care of yourself. And when you have pain or discomfort, reach out to somebody who can actually help you find the problem and solve it, rather than just let me take an Advil and push through it.
Exactly. No, that's exactly what it is.
That's such an interesting career field to go into. So, just to circle back to where we started, what was it that made you originally decide you wanted to go into therapy of some sort?
I don't know. To be honest, I really don't. I just knew. I
Just
just knew
new.
always that I was going to be in the medical field. Perhaps it's just the way I thought I would best be able to give the love back that I received
Mm.
when I was young, and I still do. Continue to receive all this love from my parents first and foremost, but also from my patients. I can really tell that they enjoy my treatment. So I
Yeah.
just feel like that's my way of giving it all back. And perhaps for someone it's something else. This
Mhm.
is my way of doing it. This, I
Love
think, was my
that.
calling. And
Love
so
that.
it's been, like I said, a really fun journey, uh, that I haven't really looked back ever since I started doing it. So I'm most grateful, really, for having had the luck of falling into it right away without having to explore different options,
Mhm.
different jobs, and employment. um,
Yeah.
this way I just got into it right away. I fell in love, and this is where I am.
That's awesome. So, what's one thing that you wish more people knew about physiotherapy and what you do?
um, I guess I wish people knew that it can solve a lot more problems than people
Mm.
may think it can. A lot of people will think that physiotherapy only treats athletes or sports injuries, right?
Mm.
But there's so much more to it. For example, I don't do any of it, but we treat a lot of cardiovascular problems, so people with, heart or lung issues, or, for example, people with neurological issues, with damaged nerves or the spinal cord, or things like that. I haven't worked with that kind of population very much.
Mhm.
My focus is on another, but yeah, no, we cover a wide range
Awesome.
of health issues. So um, I think it's worth a look, really. And if it helps, great. If it doesn't, that's also okay. Maybe it's not your type of
Mhm.
modality, uh, but we can treat quite a few things, really. So, um, just, I guess, educating people about that, I
Yeah.
think, is important.
I think so, because as we said a little bit earlier, a lot of times people just don't know what their options are, and
No,
it's really up to us to not only empower ourselves, but for those of you listening or watching, think about the people in your lives who you could share this with and just let them know, hey, have you looked into this as an option? Have you researched whether there's somebody near you, or get in touch with Aleksandra and find out if maybe this is something that might make a huge difference in your life.
Exactly.
Um, yeah. So again, guys, the website that you can connect with Aleksandra on is anphysio.ca. Spelling that just in case you can't spell the word like I can't. Anphysio.ca. There'll be a link below the video or near the audio, wherever you're listening. I encourage you to reach out to her, especially if you or someone you know is suffering from any of the things she mentioned, any kind of chronic pain or injuries that you might be looking for a slightly different solution to really solve the core issue and help you learn to prevent it, to have a better quality of life. Aleksandra, thank you so much for joining me today.
Thank you so much. This was awesome. I really
Yeah.
enjoyed sharing my message, and I hope it helps someone.
Yes. Yeah,
Thank you.
and guys, remember, make sure that you are getting exercise, that you are frequently changing position, that you're doing the things that Aleksandra shared, because it does make a big difference in how your body feels and functions. And as entrepreneurs, we all know that when you're not feeling your best, you can't perform at your best, whether it's in marketing, sales, working with clients. It's such an important piece to take care of yourself. Thank you again, Aleksandra, for joining me today. I'm excited to get this episode out there. And again, you guys can connect with her at anphysio.ca. Make sure you tune in for the next episode. Click subscribe, like, and follow me wherever you are listening and watching at.